Mental health care in Nepal. If you or someone you know is in crisis, please call 100 or go to the nearest emergency room. Mental health challenges have escalated to high levels nationally, which is not only causing a negative impact on personal lives, but social and professional lives as well. Especially during this anxiety-inducing time of a global pandemic, people are facing a huge amount of distress which needs to be addressed. In this video, I'm going to talk about mental health challenges, what can cause them, who is at most risk of mental illnesses, and also talk about an emotional support resource provided by Clinic One, which will be launched to help those in distress, especially in the light of COVID-19. Starting with the definition, a mental illness can be defined as a health condition that can change a person's thinking, feeling, or behavior, and that causes the person distress and difficulty in functioning. As with many diseases, mental illnesses is severe in some cases and mild in others. There are different types of mental illnesses, including depression, anxiety, and obsessive-compulsive disorder, or commonly known as OCD. Each illness alters a person's thoughts, feelings, and/or behaviors in distinct ways. Some contributing factors to degraded mental health include distressing and traumatic circumstances, such as assaults, in addition to academic performance demands among students and professionals, as well as social isolation and loneliness. Focusing on the mental health condition in Nepal, 75% of the general young adult population report mental health symptoms before the age of 24. And sadly, there is no concrete data on adults over the age of 25, but the Ministry of Health and Population of Nepal estimates that around 2.2 million adults suffer from mental health issues. Despite the high prevalence, there is still a stigma against seeking the appropriate care for mental health issues, and people with mental health problems are generally poorly treated in Nepal, which may lead to involuntary seclusion and isolation. With such minimal resources during this time of a global pandemic, it can be difficult to ask for help, especially as the level of anxiety rises with the uncertainty of the fast-spreading coronavirus COVID-19. The devastating effects of COVID-19 on mental health were seen through recent reports, which show that a total of 1,277 people committed suicide in Nepal within the span of 2 months during the first lockdown period in March 2020. And on average, this data is 20% higher than the previous year, which is extremely alarming. With the economic, financial, personal health, housing, academic, and employment stress that was brought upon the world by the pandemic, loss of friendships, closed ones, relationships, and social isolation also played a huge role in increasing the suicide rates of the country. With or without the pandemic, managing mental illnesses can feel like a never-ending balancing act, but we do not have to do it on our own. With the increasing rates of loneliness, abuse, and mental health issues in our country, Clinic One has been working to develop an easily utilizable emotional support service for those needing emotional support, crisis intervention, and informal counseling. We are launching an emotional support hotline and text line starting today, which can be utilized by all Clinic One patients as well as the general population of Nepal. This free service was developed to provide psychological support to those who are affected by the COVID-19 pandemic, those who do not have access to mental health care, and anyone who is feeling lonely, isolated, or simply wants to vent out and talk to a friendly voice. Both the hotline and text line operate from 9 a.m. to 12 p.m. every day and are also available on Viber and WhatsApp. More information can be found on our social media, and please don't hesitate to contact us if you have any other questions or concerns. Thank you for watching.